Hi and welcome. I'm trying to learn medicine, today Brucellosis, and after we're done with it, we call it blue short impingement training. And if you participated in the short impingement training, then it's going to be on risk. And Brucellosis is a disease, and we're probably talking about internal anatomy and diseases. And this is no medical advice, we're just learning about it. Brucellosis. This is chiefly a disease of cattle, pigs and goats, which is sometimes caught by humans. Okay, brucellosis is something which cows, pigs and goats have, so animals, domesticated animals, but also humans can get it. The disease is not very common in Britain. This is written in a Britain book. The disease is not very common in Britain, where the type found affects cows only. And this book is 40 years old. Affects cows only. I know that there was no case, I think, in the last 20 years, I think. At least not cows. There were 2 cows found, but they were born before. It was a little outbreak around 2000. But whatever. The disease is not very common in Britain, where the type found affects cows only. It is caused by a bacterium called Brucella abortus, which often causes the infected cow to abort. Okay, there's a bacterium, and that can be had by animals, and cows can have it. And the bacterium is called Brucella abortus, and it leads to an abrupt abortion of the calf of a cow. I don't know what it's called when it's still inside of a cow. It is also known as undulate or abortus fever. Brucellosis can be caught by people, such as farmers or vets, who are in contact with infected animals when they are calving or having a miscarriage, or by people working in slaughterhouses. Okay, people basically working together with cows can get that, but possibly also that is the British perspective. So in other countries, maybe also by other animals. It can also be caught by drinking milk straight from an infected cow without the milk first being pasteurized or sterilized. Okay, if the milk is directly drunk from the cow and not pasteurized or sterilized, I don't know exactly what it means, but it has something to do with cooking the milk. It is not likely to be caught by anyone else. Okay, brucellosis is something which can be caught by people working together with farmers or drinking directly the fresh milk of cows. Symptoms. Fever in recurrent attacks. I think this is now for humans. Fever in recurrent attacks, headache, sweating, fatigue, weakness and lassitude, joint pains. Okay, fever, headache, sweating, fatigue, weakness, lassitude, joint pains. Incubation period 7 to 21 days. Duration usually 6 weeks or longer without treatment. Causes bacteria. Complications not usually any, but very rarely the infection may affect the testes, lungs or hair or heart. Testes, lungs or heart. Treatment in the home, none. When to consult a doctor? If any of the symptoms appear in someone who is in contact with cattle or goats. Okay, if someone was in contact with cattle, with cows or goats, they should go to the doctor. Do they say they have fever, headache, sweating, fatigue, weakness, lassitude, joint pains? I don't know what lassitude is. What the doctor may do? Take blood tests to confirm the diagnosis, prescribe the prolonged course of antibiotic tablets, give a short course of injections. Prevention. This depends upon eliminating the infection from cattle. Female calves can be immunized against brucellosis, but there is no necessity for human beings to be immunized. Immunized? Immunized. To be made immune against it. There's actually something for the female calves. Farmers are obliged by law to slaughter infected cattle. Okay, they can, as long as they didn't have caught the bacterium Brucella abortus, they can be immunized against it, but if they have it, they have to be killed, according to law. Do not drink milk until it is pasteurized or sterilized, do they advise. Outlook. With treatment, health should return completely to normal. Is there a second disease, or is there the one? Outlook. With treatment, health should return completely to normal within a few weeks. Without treatment, the infection may recur over many years and the affected person may feel unwell, weak and depressed over a long period of time. That is very interesting. There is no another disease which I think of or not. It's very interesting. Brucellosis. It can cause the person to be over years unwell, weak and depressed. Okay, that is very interesting. I thought it would kill the person, but maybe that's another disease. And I thought it would happen rather quickly, not really fast, but within a few months. They don't say that. Okay, the outlook they say of brucellosis, with treatment, health should return completely after 6 weeks or something, and without treatment, then the infection may recur over many years and the affected person may feel unwell, weak and depressed over a long period of time. That is interesting. We have to get at some point the difference between bacterium and the virus. What if that's the reason why this bacterium can stay for a long time? But no two other things, I think. I don't know if I want to say the first thing. But I read something, because I'm going to say it, because we're also after that. That's something with carriers, that is also bacterium, or different types of bacterium living in the mouth, and they causing the carriers, the rotting of the tooth, or eating the tooth away. That's also a bacterium. And now the other thing, we were talking at some place about precipitate? What was it? Precipitation? Whatever the word. No, I heard someone using it, and it was someone doing a chemical experiment about carbon chloride, and the person said in the sentence, you can see nice precipitated the copper on the aluminium. So it actually just means precipitate, or whatever the word is. When it goes down, like rain and snow, all what is coming down from the heaven is the precipitation, or whatever the word is. But it can also mean to have an effect upon it. It was in that book, it was used in the book in that sense. It means to come down on that, to have an effect on that, or in the sense of meteorology, to snow and rain. It has an effect on it. It comes down on that. Okay, now we know whatever the word is. That word? No, that was a medical part. If you were here for medicine, you can go directly to the next part of medicine. We will continue now with short and visual training. If you stay and participate in the short and visual training, then it's better the honest. Good in stable stance. I'm doing shorter circuits. Go back, up, and front, and down. And one last time. And backwards. And last time. And now, long arms, strong fists, and we're going as far back as we can with the shoulders. And high up, and in front, and down, and again. Back, up, and front, and down, and not backwards. Up, and back, down, and front, up, and back, and down. Next exercise. Go a bit into the knees, hinge forward with a straight back, let the arms hang, and pull the scapulars together with effort. Big fists, and with the arms up and stick, pinch the shoulder blades together. Again down, and the shoulders down. And another time, pinch the scapulars together with effort. Big fists, lift the arms up and pinch the scapulars together. Arms down, shoulders down. And now the she's jump up. Into the knees, hinge forward, make a jump back, the arms hang, big fists, the arms to the inside, lift the arms high up and bring them together. Straighten up and bring the shoulders down and together. Okay, the arms high up and together, shoulders down. into the knees, hinge forward, round back, let the arms hang, make fists, and the arms to the inside. Lift the arms high up and bring them together. Straighten up, bring the shoulders down, together. Nice. Now, lift just the arms up. If this exercise causes pain, then don't do it. We just want to relax the arms a little bit, and also we want to observe what the scapulars are doing. We want to observe we can see the shoulder impingement happening or not. Now the arms at the side, and again, just observe what the scapulars are doing. They should go now a bit to the outside of the rib cage, back together. Again a bit in front, and a bit back. Next exercise, word lifter. Good stable stance, long arms, strong fists, shoulders down, together. And now turn the arms to the inside, arms to fists. Shoulders down, touch together, arms to the inside. Now the arms to the outside, shoulders down, touch together. And change again, arms to the inside, shoulders still down, hands together. And arms to the outside, shoulders down, together. Now the arms to the side, hands on back into fists, a bit in front, bring the arms into pronation in front, and the shoulders down, hands together. And the arms back, and this time also shoulders are changing up and in front. And release, to the other direction, front again. And the arms with the shoulders down, hands together. And change it last time. Arms back, shoulders up, and in front. And release. Next exercise, a shrug. Lift the arms up, and shrug the shoulders up, and down. Again, the arms up. Shrug the shoulders and down. Again, the arms up. Shoulders and down. And last time the arms up. Arms up and down. And now we're pressing good. Arms together. Bit to the downside, to the outside, inside, and outside. Just a couple of times. And it was like last time. And now the sundial. You can use also something else. Have it with a long arm at the outside. Let it fall down and try to catch it again. And we are. And now we're stretching. One arm in front, shoulder is back, down, pull the arm in, have flat fingers, try to relax the arm. Go a bit back with the shoulder, and turn the palm up to the sky a bit. And the other arm in front. Shoulders back, down, pull the arm in, have flat fingers, try to relax the arm. Go with back of the shoulder, and turn the palm up to the sky. This was the shoulder movement today. I thank you very much. Next time.